Good morning, everyone, and I think a great start to the day today by Dan and our guest. And it's absolutely fantastic to have Marcos here. And Marcos and I were just chatting in the corridor. And obviously, as Sarah said, he needs no introduction. He's also a former executive secretary of the Stop TB Partnership, and while he was there, he's one of the founding directors of Find. So it is especially great to have him here and sort of get his thoughts on some of the burning or critical aspects that we are discussing from a diagnostic standpoint. Uh, so Marcos, the pandemic, it brutally exposed the fragility of the supply chains within the LMICs, and particularly because, especially for diagnostics, both the high-income countries as well as the LMICs, they were dependent on a limited set of manufacturers to meet their diagnostic needs. So while there has been a sort of a ramp up in diagnostic capacity during the course of the pandemic, but if you really look at it, I mean, it is limited to a few high-income countries in North America, Europe, and in Asia. There have been a lot of conversations in the presidency of Indonesia, the G20 presidency of Indonesia, and India around the need to sort of bring the focus on establishing regional manufacturing networks, essentially bringing the capacity for manufacturing within the countries so that they can not only meet their own needs, but also sort of serve the regional needs. So I wanted to get your sense on, where do you see the challenges here? And more importantly, I think the presidency shifts to Brazil next year. So how do you make sure that there is a continuity of dialogue? And more importantly, how do you make sure that there is real action happening here? So if you could talk to us a little bit about where do you see the opportunities, and do you think regional manufacturing is something which is important to meet the health needs in the Latin American region?
But thank you. Before I answer your question, thank you for the invite. And let me just say congratulations to Find for 20 years. And I need to pay tribute to my good friend Giorgio Rosigno, who was the first, some of you may know Giorgio, who was the first CEO of Find. And I remember when I took over in 2003, Stop TB Partnership, one of the first calls I got was from Giorgio, talking to me about diagnostics. That's a long way. But for more than 20 years, we've been talking about point-of-care diagnostics for TB, and we're still talking about it. It's a human disgrace. So it's about time the G20 start talking about it. They are responsible for 85% of the global economy. And if we talk about ending the last session, universal health, it shouldn't be universal health coverage. It should be universal health. It's not only about coverage, it's about access. We can have coverage, but if people don't use it, if people are 20 kilometers, then we have a problem. It's not only about India, Indonesia. Kudos to the two countries for taking, and I saw what Find did in India recently, but I think it's a continuous process. History has shown that. And Brazil is the next one. So there's tremendous opportunity in Brazil to push forward for this. And I encourage Find and partners and those working in the field of diagnostics to start early, because the advocacy, the nitty-gritties, the behind the scenes are the key here. One of the advantages that is Brazil is also that the Pan American Health Organization, the organization for I work now, has elected a new director, and he's Brazilian, Jarbas Barbosa. So he's very, very in tune with G20, in tune with Brazilian authorities. Actually, yesterday we met with the minister, who is extremely committed to take some of these issues into the G20. And Jarbas, for you to know, just created a new department called Innovation for Medicines and Technologies to push forward the issue of diagnostics, new medicines, vaccines. Why Latin America cannot produce their own vaccines? And Fiocruz produced some, yeah, but we could do more. And because middle-income countries, growing economies, the problem is inequalities. So I think it's a tremendous opportunity for the international community to push forward, to use the civil society to demand the G20 and other platforms put this into into the high profile. A year ago, and I finished with this, 2 years ago, in the middle of the pandemic, I received a phone call from my good friend Patricia Ugarte, I think, from Peru, Patty, asking me, can you talk to someone about diagnostics? Because this is the thing that primary healthcare needs strongly. So I'm pleased to see that an alliance was launched a couple of days ago. I think Jarvis was there. So this has been neglected. Started good with Fine and others, but 20 years, it's about time we do the push thing that we need to do. And is not only accessible to high-income countries. Because if we talk about universal health, if we talk about primary health care, this is about the people. It's not about me, it's not about you, it's not about us. It's about the people. So affordable, easy, feasible, and usable, user-friendly. Why the hell I cannot do my own testing?
Thanks, Marcos. I think it's about time, as you say, and I think you hit all the right buttons in terms of UHC and PHC, and I'll come to that in a second. But you also made a very critical point about access. One of the challenges which we saw during the pandemic was this, and which was largely responsible for inequities from an access standpoint, was the affordability issue. And then there were several other challenges which sort of limited the access to these technologies. So while it'll be great to have the countries invest in local manufacturing and get the donors and the funders to talk about regional manufacturing, how do we ensure, and this is the typical valley of death that we have in the product development, is that once you have the product, it takes, how do you get it into the country health systems? How do you get the countries and the governments to buy? How do you sort of overcome the complicated procurement processes and systems and the regulatory and all of those challenges? So maybe if you could talk a little bit about your experience and in these specific aspects of access to the
someone just asked about the PQ of WHO, which is slow. I think the pandemic really shows us what the weaknesses and the problems we have in health systems. They are slow taking on board many of the new innovations. In Latin America and the Caribbean, we have 1,000 gene expert machines. For a 1 billion population region, I don't need to say more. PAHO just launched last year a new platform to push forward technology transfer for COVID vaccines, but other technologies, health technologies, including diagnostics. Middle-income countries like Argentina, like Mexico, like Brazil, Colombia, they can do it. They just need to put the political will. They are growing economically. The problem, and you rightly say, inequalities. The region of the Americas is the highest in terms of inequalities of the 6 regions of WHO. Economy is growing, but the wealth is not well distributed. People living in situations of vulnerability, indigenous groups. When President Lula in Brazil took over, he immediately went to the Yanomami population and saw how devastating was their living conditions. But only women, Afro-descendants, LGBTQ plus people, inequalities, and they are not accessing those tools. Why not? So to me, and the other thing was that the logistics, the supply chains, Latin America and Caribbean still depend from faraway countries for many of these tools. And I don't need to mention countries because you all know who they are. But they should not. We should not. We should be developing our regional networks, our regional hubs. It's about time we decentralize, Sanjay. The issue of a central reference laboratory, it's, to me, an excuse for us to continue saying we don't develop. We are still developing. We should have these decentralized tools at the periphery, at the community level. And the experience shows that when community leaders are engaged, people listen. One of the problems in Latin America is out-of-pocket expenditures for poor people. But if we have these tools in their community, and just to say, diagnostic could be a strong driver of integration. Why? As long as you put the test there, we need to find the medicines. We need to find the doctors. We need to find the training, because that's the other issue in Latin America and the Caribbean, human resources. So for me, it's a most decentralization, but we need to find the right tools. Because also, and I'll say this very responsible, many companies come and try to offer the holy grails with high prices, with unaffordable, and sometimes countries get into the business. This is why it is a joint work. It's not only one, it's not only fine, it's also partners. It's also technical cooperation. It's also capacity building. But it can be done, because we have seen a lot of progress in the last 20 years. So, and I think we will have point of care. We will, and we have to. That's your responsibility. It's a moral and social responsibility. So decentralization, regional networks, countries are getting prepared for that. And they are demanding, because the pandemic shows they need to demand. And they need to say it's a global responsibility. Cannot be only accessible in the G7 or the G20. We have to have it in Haiti. We have to have it in Honduras, in Guatemala, but also in Africa, in Asia, everywhere.
So talking about point of care, and I know Dan mentioned this, so we have a really cool suite of some POC technologies. I mean, this is obviously, just kind of scratching the surface, and there is Find and partners, we are incubating a solid diagnostic technology pipeline, and it's great to hear that countries are sort of ready for that, and we look forward to forming these strategic partnerships and working with organizations like PAHO to sort of expand access to these technologies once they become available. In the post-COVID world, there is a strong political momentum around pandemic preparedness. I mean, it's the kind of buzzword. I know our previous panelist also spoke a little bit about that. So I just, had a slightly provocative question, is that one, you spoke about universal health coverage, and how can we get the countries to sort of, leverage this momentum around pandemic preparedness to invest more in strengthening the health systems to meet their everyday health needs? And do you really think the countries are putting their money where their mouth is? It'll be great to hear some examples and your thoughts on.
I was, before doing this job of assistant director, I lead all the technical entities in PAHO, about 8, non-communicable, communicable, have several directors. But I was director of communicable diseases. And I had the privilege or the opportunity to lead the PAHO team on the preparedness efforts for Zika and Ebola in the Americas. We needed to be prepared. So I did a study, and I was just telling you how well were the countries prepared for Ebola, despite that they report every year on the IHR. It's a report, it's a report of the country. The paper is published in the American Journal of Public Health. They were not really prepared. They needed to advance. To me, it's now before and after the pandemic, because this one changed everything. And if countries don't take action, well, they are blind. If the international community doesn't take action, we are blind. And it's not only, as my predecessor says, it's not only about only WHO, it's about all of us working together, making sure we put together everyone around the table and bring the value added of everyone. Countries like Argentina, and the minister is here, she's very much interested on this. They pushing this in their own countries. Brazil, Minister Nicia, she was the president of Fiocruz before. And Fiocruz is one of the top centers in the world on research and development in the South. But there is a caveat there. Countries can be making progress, but governments come and go. We need to educate them. We need to keep doing the political and development advocacy. So these things is kept in their agendas of the new leaders. Because every leader comes with his own priority. It's up to us, the international community, the civil society, to say, we are not yet done. In the Americas, if I give you an example, the main profile is now non-communicable diseases, diabetes, cancer, cardiovascular diseases, because of the great job the countries did in communicable diseases. But we haven't finished the job in communicable also. There are about 35 diseases we have mapped that can be eliminated by 2030 if we do the final push. And the countries are the ones to do it, because it's not us. We need to respect the countries, we need to work with them, they are sovereign, but the political advocacy is important. And that's where I see the civil society, and we all know the best example, HIV. Why HIV was able to build such a movement that today we have 4 generations antiretroviral or 5th generation, TB still we don't, and there is a partnership that brought together some people from the HIV community to help, but we need to do much better to ensure that the leaders, the policymakers, get this serious, because I think they are, because the pandemic has changed everything, but there is always a risk. And I just, published a commentary in the Lancet the Americas, and I concluded saying, gains are very fragile. They can go back, and the pandemic set back TB case detection by 20%. Immunization coverage rates down. So it's an ongoing, it's a marathon, Sanjay. It's not, and we need to keep doing it, advocating. We need to keep passionate about this, and not thinking we're going to solve it. But again, it's about the people. It's not about my personal thing, your personal thing. It's about those people in need.
And I think what you say sort of also resonates with what Dr. Tedros said, yesterday in his address, is that the threat of the pandemic is, still there, and we are likely to see another pandemic. So, I mean, as you say, if we haven't learned our lessons from the pandemic, then God help us. I know this is supposed to be an interactive session, and I'm supposed to follow a certain format in terms of the Q&A, but I wanted to make sure that we are engaging the audience enough, and if there are any burning questions on from Dr. Marcos around UHC, pandemic preparedness, local manufacturing, it'd be great to have these questions from the audience.
Let me add something while they think. One of the good signs that we're seeing on this issue of the countries being prepared was seen yesterday at the Assembly. They remained until 11 midnight discussing those pandemic treaties, IHR, because countries wanted to speak. It's a sign, and it's a good sign in the right direction, in my view, that it's a turning point, because we talk about death, about the damage of the pandemic, but the pandemic brought also opportunities to us to grab it by the horn and say, enough of this. Diagnostic can be a strong driver of universal health and integration.
Hi. A question for you. In terms of both local production and regional hubs, as well as not just focusing on the low-hanging fruit, the tests that are easy to make where there are markets. Like, we don't necessarily need another COVID rapid test, for example. But to look at more sophisticated and next-generation diagnostics that should be also decentralized. I'm thinking of CRISPR, that could obviously play such a pivotal role in terms of updating based on new findings, new sequencing data, et cetera. So I just wonder, given CASPR in Argentina, have there been discussions within the region about CASPR developing, let's say, platforms so that you don't have to rely on the monopoly that Cepheid has, for example?
I couldn't agree more with you. We don't need one test for a disease. We need multiple testing.
So talking about, I think it's a nice segue to my next question, talking about levels of care, and specifically talking about the primary healthcare. We spoke about the point of care technologies, we spoke about the multiplexing as far as point of care is concerned, and obviously the intended setting of use is the L1 or the primary healthcare. But I think despite the fact that there have been a lot of publications, there is a lot of evidence to say that countries who invest in the primary healthcare, there is that much more life expectancy. I think I was at a seminar which was, conducted by the Indonesian Ministry of Health, and we had Atul Gawande from USAID who spoke that in the United States, the life expectancy dropped from 76 to 71 during the course of the pandemic, and they really need to up the investments. And here we are talking about the United States, the first world. So I really wanted to get your sense on, how can we sort of, talk to countries and change the paradigm, and get them to invest more in the primary healthcare. And because, you spoke about the costs to the patient, and if the patients are able to get the right diagnosis and the right treatment and the consultations at the very first level of care, you're sort of, they're able to manage their health better, and more importantly, you're able to manage the costs and prevent people from going into poverty. So any thoughts on that?
Yeah, I think it's not only a matter of showing ministers and policymakers the value of the products we have, but it's also to make the business case. And how many lives they will be able to say, how many deaths they will be able to prevent, if they invest in X or Y or Z mechanism. How fast they can put people back into the community to provide for their own families. Because when people get sick, they cannot go back, they cannot go to work, they cannot provide for their children or their family. So it's a combination, and this is what I believe, because I never believe in I know everything. It's a combination. We used to organize in the Stop TB Partnership high-level missions to countries. And I remember we went to Ethiopia, the country of Dr. Tedros, and he was minister. And we brought different partners, and Georgia was part of that mission. Because you have to be able to let to talk to the governments also, conveners. And this is the most important things of Alliance, for the Diagnostic Alliance. Make sure there is a convening power to bring experts around the table that could talk from different angles and build the business case for the governments for they to come and convince, oh, this is good for my people. This is going to be good. So this is my legacy. One of the things I used to with ministers, Minister, if you eliminate this malaria in El Salvador, we certified El Salvador 2 years ago. Argentina was certified, Paraguay for malaria elimination. And this year we're certifying, next year, Belize. But one of the things we use is your legacy, Minister, because you will leave at some point. But when you leave, you could say, I did this, or I contributed to do this. In life, you cannot empower broker jobs. At the end of your career, you will say, I was able to do 1, 2, 3, and 4. I was not able to do 5, 6, 7, and 8. I leave it for the next one and the next generation. So for me, bring the value added, prepare the business case, very well prepared, because one minister told me one day, and that's the other thing, I need to sign like 700 forms because donors, because partners, because NGOs, and my job is signing forms of projects they give us and some money. So let's find a way to do it much better but at the same time they listen. And if we sell it, because what the Minister of Finance and Economy tells them is, oh, sorry, but I need to build houses, I need to build roads, I need to buy food for the people. So we need to sell it strategically, politically savvy, and showing the benefits for the people.
Yeah, so I think you made a great point about business case, and oftentimes I think the challenge with business cases is that there isn't enough data to be sort of leveraged into these models to be able to get those stories in front of the ministers for them to make economic decisions. Sorry, I think there's a question.
Hi again, I'm Jimmy Yu from USTA. Talking about a diagnosis here, most of the people talking about more like the big things like TB, HIV, malaria, all those. But as a manufacturer, I was wondering, is there a big need for test for like zoonosis, okay, like mouse, food diseases? Is there a big need for that? Should we develop those?
A question related to what you asked about preparedness and resiliency. If we are able to improve surveillance with some of these tests for many of these zoonotic diseases, then that will make life easier. In the Amazon basin, there are hundreds of viruses that have not been characterized yet, all with pandemic possibilities. So we need more tests. It's not only about TB, malaria, HIV. I just spoke about 35 diseases that needs to be eliminated in the Americas. If I have better tests for some of them, and people will say, well, it's the cause, it's the thing, and we understand all that, you know. But when the Yanomami population is the only foci group, the only group still in the Americas living with onchocerciasis or river blindness. In the border of Venezuela, we only have one foci to eliminate onchocerciasis from the entire of the Americas. You know, and we need to finish the job because diseases have shown epidemiologically the famous U curve of concern. It's a famous epidemiological curve. Diseases go down, governments say, oh, let's pay attention to other things, we're almost there. Diseases come up again. So it's not only about TB, malaria, HIV. To me, if these treaties and these negotiations goes well, let's see, because you know how it is, and we are able to come up with something that helps to improve surveillance, helps countries, you know, to say, to deal with this at the beginning and know when the pandemic is there, because the costs are huge and higher for the pandemics and in the middle of the pandemic. But if we are able, prevention is the way, preparedness is the way, and diagnostics will play a major role. That's what I believe.
Okay. Yeah, talk just a little bit more. You're talking about the surveillance tools to do it. For example, such as tools like this. You can take it, you can do it in the Amazon, in the desert, in the mountains. It's self-sufficient. You don't need any other reagents or equipment to do it. It's self-sufficient. I guess this kind of type of test could be very good, useful for zoonosis, you know.
I'm sure it is. I'm sure it is. But I let others to decide, those who are in charge of pre-qualification and the things, and minister, regulatory agencies. Remember something, Latin America and the Caribbean, that's what I said, Latin America and the Caribbean could do it. We have strong regulatory agencies, Anvisa, COFEPRI in Mexico, in Argentina. So I'm sure it is. There are others like that, like yours also, I'm sure. But that's one of the other issues. Many issues out there, many devices, and sometimes ministers are bombarded, you know.
Thank you. Smilka de Lucigny from Unitate. I just wanted to bring
the
us
famous Unitate, yeah.
Thank you. I wanted to bring us back to the business case, because what we have seen that it's not often an issue to convince the governments that a certain test is necessary. We, for example, worked with the government of Guatemala on cervical cancer screening with HPV tests. It was very easy when also in terms of them then allocating the domestic funding. But what we came across as an issue is that the regulation of distributor markups really prevented that same government to access the price that we were accessing for the diagnostic tests. So if we were buying the HPV test for $10, the government got the quote from the local distributor for $70. We are talking about the sevenfold increase. So I just wanted to also bring the attention to both responsibility of manufacturers to control their commercial channels, but also governments to control the markups in the way that these are actually feasible then to scale up the programs. And maybe you can comment also on that. Thank you.
Well, I wish we live in a perfect world, because you know how it is in many developed, let me say now, be politically correct, in many resource-limited countries, where a lot happen in money traffics and bribes, corruption. We have those. Even sometimes we are afraid to talk about it, but we have those, and you say it. How can a test that can be acquired by $10, we're now talking PCR for HPV diagnosis, it's sold at $70, and then you ask yourself, why they buy it? I think you know the answer. I don't want it to, but we need to continue working much better. They couldn't. But still it's offered at $70.
It is offered, yes.
Manufacturers needs to stop double standards.
I think I can.
And I'm not saying you are.
I just wanted to follow up on that, and we are I think, a similar challenge, and this is about TB, and this is a high disease burden country in Asia. I won't take the name. So they have, obviously, they're buying these gene export cartridges, through the Global Fund money, and then they're buying it through the domestic budget. So when they buy through Global Fund, it's the excess pricing of $10 plus, which comes to about $12. When it comes to domestic budget, $17.50. And the bulk of the purchase is actually on the domestic budget. So I think we are trying to sort of analyze this, and what we found is, while there are challenges on the side of the distributor, I mean, the markups are there. I think the markups were like 7 to 8% on top of what they would, provide for the Global Fund money. What we also found is there are inefficiencies, for example, within the governmental procurement system. Like they have these, in their quest for decentralization, what they've done is that they have asked the company or the distributor to sign some 700 procurement contracts. So you can imagine the challenge that the manufacturer has. So I think it's the point which I wanted to make is that it's important to have a dialogue both with the country governments as well as with the manufacturers to ensure that they're getting the bang for the buck, and more importantly, getting the test where it is needed. I think
this is why we also have to create or contribute to create the ideal ecosystems in the countries, for research and development, for platforms, for education, because sometimes it's lack of education, and sometimes manufacturers have also costs, other indirect costs in domestic things. So, and it's true, they have it. So it's a complex issue. Huh?
I have a question there.
Hi, my name is Megha. I'm from Health Policy Watch. Actually, thanks for that discussion about manufacturer and government responsibility. Given the all-round criticism about weakened language around equity and access in the recently released draft of the pandemic treaty, I was wondering to know if the PAHO bloc what the PAHO bloc's action would be. Are you expecting to push back to tighten the language around access and equity, especially since there is an increase in the assessed contributions to the WHO, and PAHO countries should also pay for PAHO membership? So I'm excited to know your thoughts on that. Thanks.
I think it was approved, the increase in quotas for WHO already. So it's been approved. I think the countries of the Americans are all for it, equity, and access more than 100%. So I cannot speak for any country how they speak in the assembly, but the main problem for the PAHO region, it's inequalities, it's cultural diversity, it's making sure everyone has equal access to many of these products and possibilities. So it's not going to be easy, all these treaties and negotiations, It's a major milestone, but I'm optimistic and hopeful that it will be much better, hopefully.
So I know it's the diagnostic day, so I wanted to round off this great conversation with a question around diagnostics. So Marcos, as you know, I think one of the silver linings, I think there are very few silver linings of the pandemic, was that there was this unprecedented focus on diagnostics. Diagnostics really was shown as the first line of defense in implementing test, trace, and isolate strategies. And there was a lot of infusion of donor funding, which led the countries to build, massive diagnostic capacity. So, and I think you mentioned there are about 1,000 gene expert machines in the LATAM region, but even those are not properly utilized. So how do you, good to get your thoughts on how can we ensure that this diagnostic capacity that has been built within the countries, and we spoke about multiplex and we spoke about point of care, centralized testing, how do we ensure that this gets utilized going forward?
Well, I think it's both ways. I think countries also have to create the conditions for attracting this investment to create the capacities. There is a problem in Latin America and the Caribbean with human resources. And also in Africa. At some point, there was more doctors from Malawi in the UK than in Malawi some time ago. And many of our doctors and nurses in Latin America and the Caribbean are emigrating to the north because they need better living conditions. They need better living, better payments, These are the heroes of the pandemic, So, but also the conditions for the platforms to come on, for the creation of the regional networks and the country networks and making sure the Fiocruz of today, you know, the INS of Mexico get on board, and because there are conditions the countries need to create also to facilitate this process also, and I think dialogue is the critical issue here. And if we are able to craft a good dialogue, I think we are able to find consensus. I believe in consensus. Sometimes it's difficult, but for me, the most important thing is the interest of countries now in doing this. If you talk to Minister Bisotti of Argentina, Minister Nisia of Brazil, Minister Tufton of Jamaica, for instance, is such a passionate. Yesterday he spoke at the plenary. He mentioned 5 priorities for his country: human resources, health financing, technologies. He talked about technologies. And the other one was NCDs. So you see, and when a minister come and mention, and he had 3 minutes to speak and he only spoke 2 minutes and said, these are my 5 priorities. So he's saying to the international community, I'm ready for business, I'm ready to open and to work on this. And in fact, when we launched this platform for COVID vaccines and other health technologies, many of the countries came and saying, we are prepared, we want to do it. And sometimes, you know that they have a long way to go. But some of them want to push forward. And some of them are prepared, some others are not. But the interest is there. It's up to us, international organizations, to keep that momentum and bring partners like FINE to the table and let's talk to the minister. You know, there are countries that are not prepared.
I think we have 2 more minutes, as Sarah Jane has just signaled.
Thank
So I think great conversations so far, you know, regional manufacturing, importance of dialogue, you know, partnerships, countries being clear about what they want. I think we are in a great state right now. And as you said, I think now is the time. So I think we can take one last question if there is from the audience.
So what do you, given the delays at WHO prequal, what do you think about giving priority review to manufacturers that meet some preferred characteristics? Those include, from a LMIC, for example, could include a price point that should be in a target product profile, one should hope, and perhaps as well using open-based systems or committing to shared transferred technology.
I agree with you.
I'm so glad.
I think it's about time. I think it's about time we, you know, WHO is not perfect, and we need to look into this also how to accelerate this PQ. In PAHO, we came up with a quick assessment process for in vitro diagnostics that are not pre-qualified, you know, and that's the reason Dr. Barbosa created a new department called Innovation for Medicines and Technologies. He wants to accelerate. You know, we are regional office of WHO, but as some of you may know, we also have our own constitution. So PAHO was founded before WHO in 1902 because of what? Malaria in the Panama Canal and dengue, and still we dealing with dengue. So anything that is in favor of accelerating and facilitating the process, I'm not afraid to say I agree, because we need a process, definitely, you know, because you cannot believe everything is the Holy Grail, because no. But it's been said several times, the PQ needs to be up to the task and accelerate.
But I think
Great. The director of PQ come this afternoon and the WHA said, you better go and do the job.
Yeah, so I think we are on time, and it's a great note that we are ending this panel is that we agree that there is a challenge, and I think even WHO agrees that there is a challenge, and we all need to work together to ensure that we get over this. So thank you, Marcos, for this fantastic and a very passionate panel.
And
I really enjoyed talking to you.
Dr. Tedros is really committed and pushing forward for this. He doesn't accept like, excuses. He wants to push it. It's very innovative in South, you know. Final message, keep pushing.
Huge thanks to you both. Thank you very much indeed. So